my colleague James just started recording, as we're going to share this for information for other people who'd like to submit an EOI for the process. So if you've got any problem with that, then do let us know. But hopefully that's okay. So without further ado, I guess we can jump into the first part of today, and that is Jade Asmunci, who is co-director of the Population Mental Health Consortium. And maybe Jay can introduce herself and say a few words. Jay's going to talk about the consortium and the wider context of the event.
Great, thanks so much, Joe, for that introduction. So I'm Jade Asmunci. I'm a professor of social and psychiatric epidemiology at King's College London and co-director of this Population Mental Health Consortium that's part of Population Health Improvement UK. So I'll see if I can share my slides, actually, because I'll just provide a little bit of an overview of what the sandpit's about. So can you see my slides? I can't see
Not
any.
yet.
Not yet.
Okay, hang on a minute. Let me just try and share again. Sorry about this. We'll go share.
It works now.
It's working. Okay, let me just see if I can move it to. There we go. Can you see that?
Yes.
Brilliant. Okay, thanks. So I'm just going to provide a bit of a brief overview about what the consortium's about. You'll see at the top of the slide, this is sandpit 1. So this is the first of 3 sandpits that we're planning to do with a focus on, and this one's focused on the built environment with a link to multiple long-term conditions of mental health. So as I mentioned, we're part of a bigger initiative called Population Health Improvement UK, which is funded by UKRI, and we're one of 4 consortia. So our consortia is Population Mental Health. You can see the little triangle in the top right-hand corner. There are 3 other consortia also working in this space. And our consortium is specifically across more than 10 organisations and across all 4 devolved nations. And the whole purpose, our mission, is to try and create new opportunities for population-based improvements in mental health, and particularly with a focus on prevention and tackling inequities in the onset of mental health problems. We absolutely prioritise partnerships, and that's across research, policy and lived experience. And where we come from is essentially this well-known, unfortunate fact, which is that in the field as a whole, there is a very small amount of money spent on prevention, only 3.9%. And our consortium is really around trying to tackle that and to try and understand ways in which we can better find approaches to prevent the onset of mental health problems. I think many of us listening are perhaps used to thinking about this in terms of secondary care. So if you think about this, if you look at this diagram here, and I include myself in this, I work in my clinical job is as a psychiatrist, so I very much work in secondary mental health care services. But actually, what we're really focused on in the consortium is moving more upstream and thinking about broader social determinants and how they play a role in the onset of mental health problems. And that's kind of where the whole idea of a focus on the built environment as part of the sandpit comes in. Now, I mentioned that we are also thinking about multiple long-term conditions. So within the consortium, we have 3 challenge areas. One is around children and young people, a second which is around suicide and self-harm prevention, and the third is about multiple long-term conditions. And in some ways, the sandpit sits within this third challenge area of multiple long-term conditions, which takes this perspective that mental health and physical health are hugely intertwined. And as you can see with this figure, as people develop more physical health conditions, they're much more likely to develop mental health conditions. And not only that, but there is a very strong social gradient in the patterning of that association. So our approaches within the consortium, to a certain extent, try and cut across single disease frameworks, and we want to move towards a much more population-based focus. So I won't say too much about this because I think this will also be picked up a bit later by Joe and Chola, but just to give you a bit of an overview, our sandpit competition is really to try and kickstart projects in the area. We're providing small seed awards between £1,000 to £10,000 to groups of people to come together to really try and explore innovative solutions to critical population mental health challenges. And we want to prioritise collaborations between early career researchers, as well as people working in non-academic or voluntary sectors and people with lived experience. And so the Sandpit event itself is to try and help those collaborations to form in order to be able to apply for these seed awards. And I mentioned we're one of 3 sandpits. So this is we're the first one that this webinar is about the first one around the built environment. We will later on in the year be planning to run 2 other sandpits around digital technologies linked to our suicide and self-harm prevention theme, and another one on schools linked to our children and young people theme. But this one is specifically about the built environment with a focus on linking back to mental health conditions and multiple long-term conditions. So I'll end there because we're going to hear a bit more about the practicalities and something from Chola about the built environment. But if you want to find out more about us, I've put some web links in there to our website, and I think we've also got an email address that you can contact if you want to find out more, and you'll probably get the details for that a bit later on. Stop sharing. Thank you.
Lovely. Thank you so much, Jay. We can take any sort of pressing questions if there's anyone has an immediate question, and if not, we'll go on to Chola, who's going to say a bit about the Sandpit event itself and a bit more about the built environment context. So
great, thank you,
Chola.
Joe. Cheers, and I see very nice to see everyone on the call. Very good attendance. Chola Köksal, I'm a lecturer in urban planning at University of Manchester, and you might think that why is an urban planner involved in the consortium? Very much the same reason that Jay outlined. One of the things we want to highlight is the upstream influences on mental health and built environment. For those on the call, I don't think it needs much of introduction, but just very briefly, the way that we're looking at built environment or urban planning is quite broad. It could cover anything from policy frameworks to land allocation, but more so that we're looking at physical structures such as homes, roads, transport, mobility, green spaces that frame our daily lives. There's an increasing research that shows that these features, the physical features that influence, have a powerful influence on our mental health. It could help improve, for example, mitigate hazards, foster conditions, or enable conditions that promote well-being, but also could cause those problems that Jay was talking about. So ultimately, we want to improve population mental health across the country and reduce inequalities, which is something that we also care too much about. So we should pay closer attention to how built environment shape not the way that we live, but how we feel as well. So one of the first sandpits we wanted to do focus on the links between the built environment, broadly defined, and mental health, again broadly defined. There is quite a lot of big, lots of areas to explore. We thought that it could be around housing, accessibility, and mobility. It could be around environmental quality, such as air pollution. It could be about placemaking, public spaces, or social connectivity and isolation. So it's quite a broad topic. And one of the main points of the why we're doing a sandpit is to broaden this conversation beyond the consortium itself, and then bring more people outside the consortium into the conversation. That's why we're purposely having this sandpit in person in Manchester, outside London. So that's one of the things that perhaps worth mentioning. I have a few slides to talk about the logistics and what we actually want to get out from the sandpit itself. And I think that will be super useful if I can go over them. It only like a five, 6 slides. So not too much, I hope. If I can find my screen. I hope you can see my screen now. Great. So we call this Innovation Lab, and you might have attended Innovation Labs elsewhere. You may know what it is. For those who don't know, essentially it's a workshop, hands-on workshop to bring organizations, businesses, voluntary, social, VSSC organizations, and academics, researchers, either affiliated university or non-affiliated, together, and then create collaborations that perhaps couldn't have happened otherwise. Co-develop strategies and provide innovative solutions to the challenge area that businesses identify. We have a very fancy YouTube video, which I will put in the chat in a minute after the slides. But essentially, the idea is that we want to create collaborations that could not have occurred without the sandpit. So we want organizations, businesses, volunteer organizations coming with the idea that perhaps they may have an idea of a business need, a challenge that will require support from researchers, either in a way of collecting more data, bringing some cutting edge, avant-garde, if I may say so, or innovative solutions to their change need, or they just need a bit of a sounding board, some kind of like some from more academically minded theoretical perspectives. So it's about creating collaborations. And that's what this stamp is about, bringing organizations, researchers together to create those collaborations. We have a facilitator called Future Everything. It's a creative consultancy who has been doing quite a few years now, who partnered with University of Manchester in the past. And having myself attended some of these innovation labs in the past, I do see that they bring lots of value in the way that they facilitate these workshops. The way that works, we have about 4 or 5, or at least we plan to have 4 or 5 thematic or challenge areas. Each of the tables will have 1 or 2 organizations have a challenge area, and then academics that's on the same table. The way that we plan to run the workshops is to identify the sort of challenges that the businesses might bring to the table, and then co-develop and understand the challenge together, and also co-develop those solutions. And what this sandpit will basically enable is, because we provide seed corn funding up to £10,000 for each of these tables, to basically enable what perhaps could have not been possible, getting a researcher, access to data, or some sort of other ways that we can actually help that solution to be flourish and actually being tested. One of the things that we really want to emphasize in the sandpit is that we really want to identify proposals and collaborations that have possibility for future large-scale funding. It could be from a research council or from organizations themselves or from the lottery fund, for example, something that I involved in the past. So one of the things that we would like to highlight is that what's this challenge area, how important it is, and whether we can actually scale this up for and leveraging future funding opportunities. We basically have 2 surveys, online surveys, which we will circulate very early tomorrow morning. And one survey is specifically for organizations, the other one for academics. And essentially, they will be asking a few very simple questions. It wouldn't take more than 10 minutes for you to fill this out. And this expression of interest essentially is there to capture areas for exploration. What are the business needs? What are the challenge areas that organizations, businesses, volunteer organizations that charities identified? How would they get help? What sort of support they will need from the academic or research community? And then whether they could commit to 2 or 3 representatives to attend a half-day workshop. Timings of the workshop is 5th of March from noon to 5:30. And we do recognize for some organizations that it perhaps be too long, or you may not be able to commit to timings. So we have monies put aside to support those people who wouldn't otherwise to travel, say that you're a non-salaried job or you're volunteering for a job. So we will also circulate that information as part of the email as well to be able to basically reimburse you for your time and for travel. What we're also looking for is commitment from those organizations that put in the expression of interest, either way of coming in with the challenge areas, with the ideas, but also if possible, if depends on the organization, whether there's also extra support beyond in-kind, but financial support they can commit to really leverage that collaboration that will emerge from the sandpit itself. From academics, quite simple. We will be asking who you are, what sort of research you're interested in, and why you want to come here into the conversation, and what sort of things that you want to get out as well. The exact format of this is how the workshop's going to run. During the 5-hour workshop, the Future Everything, the facilitators, they will be going around table to table, helping each of the challenge areas and academics to define the problem. I think should have add here is co-defining, because one of the things that we want to get out of this is actually really genuine co-production of both the problems as well as the solutions, and what might actually come out from the sandpits. And at the end, what we're imagining is end of day there will be 5 very good levels of collaborations and ideas that will come out from those tables, and then we have a jury, and then we'll have a conversation with those tables and the collaborations to identify what level of support we can provide. We have about £40,000 available for this sandpit, and we're thinking each of the challengers might pitch some idea, some collaboration up to £10,000. And then we're hoping that we can actually provide this money to get on with data collection, research, whatever that might be that you're pitching to do, and then enable you to apply for future large-scale funding elsewhere. One of the things that we're hoping to provide, however shape, I suppose that could be bespoke and perhaps change from collaboration to collaboration. One of the things that we have in this large consortium is a bunch of very smart academics and collaborations that we already have developed as part of the consortium. And I'm hoping that we will be able to also provide some support in that regard, and then really help those small seed-funded ideas to move to the next stage and create a bit of a conversation around this topic that perhaps could have not have happened otherwise. What we're expecting from organizations is essentially is commitment. Come to the table with open ideas, identify relevant challenge in the space of built environment and mental health, but also come with an open mind, expecting that when you sit on a table with people who've done research on this topic for a few years, have some experience, they may have actually provided you some perspective that perhaps might you rethink that your challenge area, or other way around, that there might be people that perhaps on the same table that have the right methodology, right skills, but not very sure about your organization or the challenge area. So you can educate them and then find ways to define the problem and the solution together. We're thinking about minimum of 2 business partners from the same organization, ideally at least 1 senior person to basically make sure that the commitment is there from the organization, and whatever solution might emerge from the conversation and the collaboration could actually be implemented within the organization or with the help of the organization later. It's been a tested model. I think university has been running these, I think since 2017, if not earlier. It's been quite successful, and I'm hoping that we can replicate this success and really kind of move this conversation a bit further, and then bring some new people, new blood to the consortium and in this space, and then really engage with quite interesting ideas and organization that we haven't had a chance to actually do that before. So this will be also our way of opening our eyes into what's actually happening in the space from other organizations that we haven't actually engaged so far. And I think that's about it. As I said, we will be circulating 2 links very early tomorrow morning, essentially to capture the expression of interest. One of the things that I really want to highlight is that we really want, we have a robust evaluation framework. So that just because you submit the expression of interest doesn't mean that you will be secured a place and invited to attend. What we want to really do is to really read who submitted this expression of interest, check the organizations, check the challenge areas, and make sure that there's a good match with what we expect from the sandpit, as well as who we expect to attend the sandpit. So the more information you provide in the form will be better, so that we can do our job better. But we intend to have a very robust and competitive expression of interest, both for organizations hoping to attend as well as the academics as well. I think that's all from me at the moment. As I said, with the email tomorrow, we will also be circulating information around what sort of support we intend to provide for those who have non-salaried jobs, volunteering for those charities, organizations, or academics who are perhaps don't have necessarily the funds to be able to travel and attend meetings like that. So hopefully that will also enable people to attend. And what we're trying to create is as inclusive and supportive environment as possible. And that's one of the key golden threads run through the consortium work as well. And hopefully that will help us to enable those who otherwise wouldn't be able to attend this meeting in Manchester. Just, I thought I might repeat that the workshop itself will be in 5th of March from noon to 5:30 in University of Manchester campuses on Oxford Road, which is basically the city centre. I think that's about it. I think, Joe, also you want to say a few words about EDI, if I remember correctly.
Thanks, Chola. Yeah, next on the agenda, we're hearing from my colleague Samati. And Samati's going to talk to us a bit about the role of EDI and lived experience in the consortium, as we're really going to be looking for those kinds of elements being brought out in applications, because that's a core part of what we do. So I'll hand over to Samati, say a few words.
Thank you, Joe. And hi, everyone. It's a pleasure to be here today and take part in this discussion. My name is Samati. I'm a project officer with Thrive London, and I've been supporting with some of the work in the consortium around lived experience, community insights, and EDI. So I just wanted to take a few moments to expand on some of the key concepts related to the consortium that might be helpful in reflecting on the criteria of the proposals and the implications for practice. And some of these concepts have already been touched on in our discussion so far. So taking a shift towards wider societal determinants of health and reflecting on upstream prevention, it becomes important that we focus on understanding prevention alongside lived experience and community voices in our work to intentionally draw attention to the intersection of structural and systemic inequalities, such as racism and socioeconomic disparities and their impact on mental health outcomes. I'm going to go a bit into embedding equity into our approach in our work. But before I do, I just want to quickly just highlight our definition of lived experience. So considering our approach to mental health within the consortium and the focus on prevention, our definition of lived experience is quite broad at the moment, and it relates to focusing on structural inequalities and systemic inequalities. So having experienced trauma, mental distress, or mental health issues, particularly in childhood or adolescence, including self-harm to suicidal ideation or loss through suicide, and or in conjunction with other long-term conditions, including physical health issues, having experienced structural disadvantage, discrimination, marginalization, inequities, injustice, neglect, abuse, or violence of any kind, which either caused, worsened, were compounded by, or were connected in some way to the mental health distress or mental health issues experienced, having experienced race-based trauma where racial discrimination, marginalization, or systemic racism has directly or indirectly contributed to the mental distress or mental health issues experienced, having experienced intersecting forms of discrimination or disadvantage based on protected characteristics such as age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex and sexual orientation, which have compounded or exacerbated mental distress or mental health issues. And we're also open to considering lived experience of disadvantage, inequality, hardship, poverty, of people who haven't experienced mental health challenges, to explore whether that will tell us something about resilience and well-being. So I just wanted to quickly run over the definition of lived experience, because it relates to these concepts that have been touched on in relation to the consortium and the kind of work that we're highlighting in this space. So, of course, by centering this focus on prevention and lived experience, and by actively embedding equity into our approach, we are ensuring that those who are often marginalized are not only included, but central to shaping solutions. And I guess the key takeaway I want to leave you with is that we want to see approaches that engage meaningfully with these concepts and with this practice to demonstrate a genuine commitment to partnerships, working collaboratively with communities and lived experience to fill the gaps in knowledge around mental health inequalities and address this. Including lived experience provides critical retrospective insights into mental health struggles, as well as risk protective and preventative factors. These insights are essential for addressing mental health inequalities. And if we truly want to understand and address this relationship between mental health and inequality, we must ensure that diverse perspectives are not only included, but actively valued in shaping research and interventions. So it's really important to us in the production of any type of knowledge that we are centering voices that are often absent and marginalized, and that we're shifting that power dynamic that we see in the production of knowledge and in practice and in policy as well. Thank you.
Thanks so much, Samati. So again, if anyone has any questions, do feel free to jump in or put them in the chat. What I'm going to do now is just take a step back and just summarize a bit of the process, because I know we've heard a lot of information now. So very, very simply, what the next sort of steps look like of the process are, if some of this sounds interesting, there will be an EOI form that you can put an expression of interest in, and we'll be sending that out, and I'll talk about that a bit more later. The deadline for those will be the 12th of February, and that will be, all that information will be sort of with the form. So 12th of February will be the deadline for the expression of interest. Pretty simple form, as Chola said, and then we'll let you know within a few weeks, so that you can make plans to attend, if successful, on the 5th of March in Manchester. So that will be the event itself, the sandpit. And just very simply, people might have been involved in different sandpit events or heard different things about it, but really for us, we want a mix of academics and community partners so that we can bring people together in the room and build collaborations based on interests that kind of converge, ultimately, hopefully funding a few projects between £1,000 to £10,000, and then sort of support you to make that project real, with all the resources that we have in this amazing group of mental health researchers we have in what we're calling the consortium. So hopefully that kind of gives a bit of a summary of the process. And again, any questions, please do share. What I do want to do now is just to really highlight some of the specification criteria that we're looking for. So when you submit your EOI, hopefully you're interested. What we will do is also include a document with some information for participants, with sort of the essential details of what you need to include. So any project that we're going to fund eventually down the line will have to include a partnership between an academic partner and a community partner, and that can happen in the room. So just to let everyone know, to be clear, that's kind of what we're going to be looking for at the end of this process. You might not know at the moment how you want that partnership to work, but just to be open to it. Another essential criteria we're going to be looking for at the end when it comes to funding is being directly relevant to population mental health. And we've spoken a bit about that today and what that means for us. We will be including some more information about that in the documents that we'll be putting online. So addressing, for example, upstream determinants, as both Jay and Samati have spoken about. And then the third key piece to this is that we're looking to expand the reach and diversity of the consortium. So really we want to have a very wide representation of types of lived experience and projects that are going to be funded. And the selection criteria we're going to be looking for at the end of the day will be things like innovation, impact, collaboration, relevance to the consortium, feasibility, inclusivity, and the type of deliverables that will be involved. Just in terms of some other sort of practicalities that we'll be looking for, we'll be wanting eventually to see sort of what your deliverables might be, delivering a research-related output of some kind, for example, a publication, and we'll be running sort of knowledge sharing events as well in the consortium. So we'll want people to be kind of getting involved in that. So those are some of kind of the key specification elements that we're going to be looking for when we're eventually judging the final projects, and we'll be thinking about that as we're looking at the EOIs as they come in. So there'll be more information in the links that Chola was going to share tomorrow morning, as he said. But for now, maybe I'll stop there and see if there are any burning questions before we throw any more information your way.
Just to add very briefly, thanks to that was super useful. And we're not expecting people to fill in application forms or submit cases for support for a long funding. But essentially what we're trying to hope is that the collaboration during the day that will form in itself will be enough to be able to, for us to judge whether there's grounds for us to, dispense the money. So once that collaboration of the workshop, you're not asking huge amounts of work afterwards to get the money. There will be huge amounts of work that needs to be done to deliver whatever solution that might actually needs to be delivered. But there won't be any long funding applications for the monies from the sandpit, because that kind of goes against the whole ethos of it. Essentially trying to enable collaboration, not hinder with extra form and bureaucracy.
Yes, so the EOI, we're just looking for a general expression of interest, nothing too in-depth. So yes, any questions that have come up so far? Does anyone want to jump in? Or has it all been extremely clear? I know we've given everyone a lot of information. No questions? Well, that's been very straightforward. We will be sharing the recording, and there will be sort of a lot of this information will be in written format as well, so you'll be able to read or watch. Okay, well, if there's no questions and we've done a great job at being very clear, then we can maybe all have some time back. Obviously, also, if you would like to, you can email us so there's a generic Thrive London email address you could email, which is info@thrivelondon.co.uk, or contact us through the website. I believe there is an email address. Patrick or Samani, do you know if that email address is operational yet? Generic email.
It is, so it was pasted in the chat by Natasha. It's popmh@kcl.ac.uk. You are also welcome to contact us via this email address.
Yeah, so please feel free to get in touch, and thanks for joining. Thanks, everyone. I'll give you 25 minutes back.
Thank you. Bye-bye.
Thank you. Bye.